From the home base in Brookfield, Wisconsin, welcome to the latest episode of Inside Connect and Simplify. I'm Roger Firstenau, Human Capital Management Consultant, subject matter expert in personal and business insurance, marketing, creative, and networking nerd. I joined the Benefit Companies in 2016. The Benefit Companies is all about changing the status quo. When we talk to business leaders, we're not talking about our services as a one-off commodity, but rather an integrated platform that gives the company back what they need, time and money, and fixes their broken and inefficient systems. My guest today is also about changing the status quo. His track record of winning, advancing the mission, organizational growth, and community service is worthy of recognition. Terry Rowinski is the president of Health Payment Systems based in Milwaukee. HPS is working to fix the broken healthcare billing system by delivering a single consolidated statement of charges that removes the confusion and redundancy we all face today. By bringing the complexity of medical billing into one statement, one payment, and one resource for questions, HPS simplifies the process, which leads to bills being paid on time. Terry, we have much to talk about. Thanks for coming today.
Thank you, Roger, and thanks to the team here at the Benefit Companies for hosting this today.
So prior to joining HPS in 2014, you logged almost 7 years with By Seasons, which most folks know is based in New Berlin, Wisconsin. Tell me about the roles you played there.
Sure. At By Seasons, as many small companies that grow to be, formidable mid to large size companies, when you're one of the early entry folks, you wear many hats. And I was really an operations and an IT guy there. And in doing that, helped set the path of growth for the company as we grew from a less than $10 million organization to almost a $250 million organization at the time that I left the organization back in 2014. And it was a great part of both my career history, but also a great part of building great people within our community here in New Berlin and southeastern Wisconsin.
So your previous experiences, including By Seasons, had little to do with the healthcare industry. What led you to join HPS in 2014?
That's a great question. And as a part of my role at By Seasons, when I had left, I was Chief Operating Officer. We were looking at things that were really, frankly, of high spend, high dollar value spend of the company, and also things that were of high impact. And high impact had many different facets. But for us, healthcare for our employees and their families, and then the bottom line spend of healthcare for By Seasons was really becoming one of our top 5 spend in terms of what we ended up occurring on an annual basis. And we really wanted to do something different. And I actually got to know the team at Health Payment Systems back in the 2010 through 2014 timeframe when we actually became a customer of theirs as a part of our efforts to go what we'll talk about later as being a self-funded employer. And trying to bring a traditional healthcare to our employees and their families. And it was an interesting journey going from a fully insured company of that size to self-funding. And put it this way, I earned some healthcare stripes and a few bumps and bruises along the way as well.
Yeah. So what are some of the negatives? I know we're going to talk about these. What are some of the negatives of the current broken billing system?
It's interesting, Roger. When I made that transition and I really played that fiduciary role as a COO of a company at HPS, coming in, because that was my role coming in as well to be Chief Operating Officer. I had the optics of what I had just experienced at By Seasons for my families and our expense line. And I really wanted to just dig in and rip it apart and see what was going on at the company and what the services were that we were providing. And as I started to go out and meet medical providers in the community, at healthcare systems and independents, I quickly realized that it wasn't really broken per se. It was actually working as designed, which is just crazy to think that of all the great things that the medical establishment has done, it has this incredibly defunct and almost backwards billing practice that leads people to a bunch of different stress and things in their lives. And as a part of that, it's not letting people have the best medical experience because they have, stress in their lives, wondering who they pay, why they pay, what they pay, and when they pay, which isn't good for anybody in terms of what's happening as they're trying to get better physically from whatever ailment put them there in the first place.
So, talk to me about how HPS consolidates that billing process.
Sure. So our company was founded back in 2005 with a premise that our co-founders wanted to really help our fellow human. And in doing that, one of the co-founders was actually in credit card law. He was helping to create portfolios for credit card companies here in southeastern Wisconsin and beyond. And he had suffered a major medical event. And when he was very fortunate to have great health care, and when he came out of that and got back home, his wife gave him a welcome gift of a dining room table full of medical bills and EOBs. And ultimately, he ended up literally putting his head in his hands, and we have a picture of this in our office, and just said, there's got to be a better way. Why can't the healthcare community and healthcare systems, give the consumer, because that's what we should be treating the patients like consumers. Why can't we give them something that they're familiar with, almost a credit card-like statement for healthcare? And that's really what he set out to do in 2005 in terms of coming up with an idea, bringing it to market in 2008, and then ultimately pivoting it as the changes in the macro financial climate happened in the world in 2008, and effectively created two products. He had this concept of the simplified bill and statement, which ends up being labeled the Super EOB and is what many folks in our community that are our customers know it to be, which is really exactly that. It's an outstanding explanation of benefits, which you'll probably never hear an insurance company say, but it makes things so simple for the normal human to sit in front of and understand what took place and when and why you owe what you owe. And then on the front side of it, just like a credit card-like statement, it basically shows, you owe all that money and to whom you owe it, and you owe it to health payment systems, because we help you effectively then figure out how to pay and pay more faster and better.
Yes, it makes sense to me because I've gone through something similar. A lot of folks have. So let's break this down a little bit further as well. So talk about how that benefits the employee, the employer, the healthcare providers, anybody else that might be a part of that scenario. I mean, there's three at least entities there. Talk
Sure.
about that.
Yeah, I really look at it as almost like a four-legged stool in terms of what we have. For the employee and their family, first and foremost, when they're utilizing the HPS solution here in Wisconsin, we have a great medical PPO network that has broad access and coverage and really good costs. And really good cost means that the employer pays less, therefore the employee should be paying their share less, as well as we do the things to try and drive down medical costs. Also, they get this consolidated statement on a monthly basis, either electronically or via paper for people that still love to get the paper statements and things. And it's simple to see, to understand, to read through. And if they still have a question in terms of something that doesn't make sense, they have one place to call, and that's us. And our advocate team jumps to their help. And if we can't resolve it with them while we're on the phone or through internet chat or whatever communication medium that they're using, we basically own the issue and we get back to folks in terms of what's going on. And issues can be really complex. If you go back and think, at times you have to call the provider medical services, at times you have to call the person that's responsible for the insurance, the adjudication of the claim, determining who owes what and when and why. We make that go away and we try and really own the issues so that the employee just has a trusted advisor at their side in terms of what's going on. That really then benefits the employer. We talked about cost a little bit earlier. The employer theoretically can pay less overall in terms of what their expenses are on a monthly basis for healthcare. And hopefully they can have great benefit plan designs that benefit their employees. So both an attraction and retention mechanism in today's world to get good people and keep great people in your organization. But also, like I saw at buy seasons when I was utilizing HPS, it kept my people actually working and on the floor. We had a manufacturing operation, a distribution operation. And it was the worst thing as a COO to see people have to come off the floor, go to my benefits people to ask questions about bills and things, and then call people and sit in their office for hours at a time to try and figure stuff out. We help get rid of that because we have access before and after hours. And again, we really simplify the process. The healthcare community, they really appreciate what we do because with how the world has been, we've effectively made the healthcare community banks. In terms of, they're non-regulated banks because they have all this medical debt that's outstanding to them from all these different people that come their way. And with us, we are paying those providers and the healthcare systems in a much faster and a much more routine fashion. as we work to collect from the people, the employees, and their families that owe the debt. So that's part of our value prop to them. And then really the community, we think that we help as well. Our part of being a corporate steward in this community is to continue to work really hard to drive healthcare costs down and our solutions to near perfection. But then also we love to give back. And frankly, the fact that we can run a company like this, that we have great employers and employees as our customers, and folks in the broker and the employee benefit consultant community that support us, allows me to employ people that love to get back in our community and do really fun things as well as a part of just being good corporate stewards. So it really has all these ripple impacts just by the fact that some guy back in 2005 had an idea and brought it to life, which is fantastic.
Did you ever do a follow-up picture to him with his head in his hands? You probably should do that. Just a thought.
We should do that.
So HPS and TBC work in adjacent areas as we offer employee benefit plan counseling, voluntary benefits, and Affordable Care Act reporting services. Talk about what you've seen change in those areas since you've joined HPS.
Well, first and foremost, our companies have had a great partnership together and have brought some awesome service to some employers and some folks in our community, and that's been a pure joy. The other thing is that this has been hard on the employer. As the employers have really understood their duty to provide great health care and all the reporting that's coming their way in present day and into the years to come through all these regulations that are being passed. We are together and your firm is helping, I'm going to say it this way, somewhat mechanize and automate some of the best practices in the industry in terms of what we do for defining, offering, and managing the employee benefit plan. And as a part of managing the benefit plan, you need to be informing the employer and at times the employees in terms of what's really going on within that benefit plan. A lot of folks can just churn out data and just throw data at the wind and see what ends up happening. But the fact that you can actually do it in a structured way that's digestible by your fellow human on the other side of the data and help them make informed decisions is really key. And I think that's a really huge value, both at what your team is doing and then ultimately what we try and help folks do through our self-funding programs as well.
So let's talk about that. You dedicate a section of your website, so hps.md, to defining and educating on self-funded insurance plans. Now, in brief, it's an employer-provided coverage plan that's not purchased from an insurance carrier. The risk to the employer can be greater, but so can the savings. So if you compare self-funding versus level funding versus fully insured plans, it's not really my area. Maybe you could take a minute to define those so everybody understands the differences of those three. So
fully insured. So fully insured employer benefit plans are truly the traditional insurance company plans where your employee base will go through a risk rating and the insurance company will effectively come up with their own tolerance for risk. And then they effectively charge you a premium that you're paying on a monthly basis to cover your employees and their families or anybody that's a benefited dependent. Your cost theoretically during the year is flat in terms of what happens in terms of being fully insured. But then as it comes time for renewal, the opportunity can be dynamic at times, depending on how your community did in its healthcare expense that year prior. I see fully insured companies really being the smaller startup organizations, and some companies are fully insured up to their thousands of employees. It really is a risk tolerance, as you had said, and then also somewhat of a philosophy of the management team and the HR department as a part of that team in terms of how assertive they want to be in the healthcare of their employees' lives in terms of what they're doing. That then really goes then, I'll call it kind of to the right on the chart, to what is referred to as level funding and self-funding. And I always say partially level funded and partially self-funded because this is where the employer does ride the risk of the medical cost in an almost fully exposed way to what happens within their employee population. And as you had said, there is risk, but there can also be great reward. Level funding is really the next logical step from fully insured to self-funding in that it sets a premium on a monthly basis, almost like a fully insured product, but then there's some opportunity for money to come back out of the plan if you don't end up actually hitting the full expense that you ended up accruing each and every month by what you ended up paying in. And then if you go further to the right, self-funding or partially self-funding, that is where your expense is totally variable on a monthly basis. And the period that we were just in, in terms of the COVID period where people were not consuming healthcare because of what was going on, you saw a lot of fully insured clients continuing to pay as they were, and some level funded, clients paying as they were as well. But folks that were purely self-funded because there was no medical expense happening were paying very, very little. So they were effectively truly riding, and that was probably the biggest point in time where you actually saw almost the roller coaster ride of people incurring medical expense and then it going to near zero, not at zero, but near zero, and companies that were self-funded or level funded really seeing that quote unquote savings happen in terms of what took place. There's other plans that are coming out now as well, Roger. So I know we mentioned those three that are the big ones, but the ICHRA plans and other variants of that as a part of the Affordable Care Act and things that are effectively being created in the marketplace to try and help small to mid-sized businesses, individual people they're looking for ways to help people when they want to use an exchange product as well. And time will tell, in terms of where that ends up being from a popularity and from an acceptance perspective as well. HPS plays really in that level funded and self-funded space because, again, we want to be a platform that the employer can effectively see and understand what's going on with their healthcare by the data that we provide them and by the data that folks like yourself provide. And then also we work really hard on cost in very non-conventional ways. And the employer and the employees are rewarded for those ways in which we really work on costs. So healthcare is really complex that way. You can throw acronyms and you can throw all kinds of names at this left and right, but really fully insured, level funded, self-funded, and then some of the newer, kind of vogue plans that are coming out as well.
Yeah, I'm not sure how you keep track of all that. One of the reasons I didn't spend a lot of time in the healthcare side of insurance world, it was too complicated for my head, seriously. So if you had an opinion, and maybe the opinion is based on, again, the company size, the risk tolerance, all those things, but in your opinion, what of those plans are do you like the best, or give me some pros and cons maybe? Yeah,
I do like fully insured plans when you have a very small company, and I really think between that one employee to that 75 range is really a sweet spot for fully insured organizations. And under 50 employees, there's community rating, which also has benefits to employers in terms of what goes on. So it can help make healthcare affordable. And frankly, if something happens within your employees and their families that is a huge medical expense, it doesn't end up kind of being a bucking bronco in terms of cost. So the fully insured aspect really helps employers have predictable cash flow in the year and understand really what their health insurance is going to cost. As you start getting above that 75 employee range and above, you're getting into this corridor, which is just great for self-funding because your population is starting to become big enough that a one-off or two-off event that happens from a major medical expense won't really crash the plan from a cost perspective. And it allows you access to your data so that you can really understand in a HIPAA compliant, which means we anonymize it so you can't see Roger had this procedure, but you see a person maybe have had a procedure. You can start to really understand when you work with your benefit consultant what's going on in the day in the life of the healthcare of your employees and their families. And you can start to utilize that data to really create real wellness plans that actually have merit and benefit because you're targeting health events that are taking place. And you get transparency more than you do in fully insured in terms of the cost of services. So then you can start to do things like offering incentives to employees to shop for high quality, lower cost type of services. You can get into bundled payment situations and other things that the fully insured carriers just really don't touch right now. So it allows an organization that has, more of a larger population, if you consider 75 and up, larger, and has a tolerance for risk, but also has a tolerance to work at healthcare to drive the cost where it needs to be to really be able to do that. And that's really why I love level and self-funding.
That makes sense to me. So thanks for that.
Absolutely.
So we didn't talk about it, but you mentioned COVID, and certainly almost every person I talk with when we have these discussions, like, all right, what was the impact on you or in the industry you're in or both? So take a minute and talk about how COVID impacted the company.
Sure.
And then also maybe your approach to doing business.
Sure. No, I appreciate that. The past 18 months have been an incredible learning experience, both from being a steward over my own company and the lives of my own team members and their families, because I take that to heart, that I'm employing people and trying to make people better humans so that they can have even better families in the community. And when COVID hit, I saw the pain and suffering in some folks, either directly or indirectly attached to our employees and their families, and that was really hard, because you want to, I want to go out and put my arms around them and love on them and basically try and help them become better in terms of what's going on. And we knew so little at the beginning that we were all in this paranoia fear phase of what to do next, which, because of how it was overrunning the medical community, caused the medical community to have to pull back on non-emergency based procedures. So as our company, is running through this, and you're in March of last year and April and May, as you saw the medical community cut off services in a necessary fashion because they were trying to deal with the unknown. Our claim volume and things that ended up happening, effectively took a lot of revenue out of our organization, a lot of volume out of our organization. Luckily, we were built for such a time as that. We run kind of like a startup. So we definitely could use a few more people in our organization in terms of doing what we do, but we're very efficient, and we use technology as a helper, not just as a crutch in terms of what we do. So it allowed us to fare very well on the financial side of what we did, and also on the operational side. And then as the medical community started to come back out of it in the middle part of last year, even though we kind of hit that bump again, we started to see people go back in for procedures in terms of what was going on. And we started to see people go back from a health and wellness perspective. Not as much as we would like. And even in present day, there still are not enough people that have made their way back in for primary care physician visits, the quote unquote, the annual visit and things from that perspective. And that's of concern to me, both on a personal level, being just a fellow human, and a business level, because ultimately I don't want that to lead to a bigger health event or a more expensive event for the employee and their families and the employer in the future. So as we are now debatably on the other side of this, and I know you can say debatably based upon the world that we live in and what's going on right now in present day in the U.S., people need to go back and make sure that they are doing the annual maintenance things, getting their screenings, getting women's procedures, men's procedures of a certain age, and things from that perspective, so that we are taking care of our physical health and wellness and our mental health and wellness, through this whole event. And it's, I pray and I hope we never, ever hit anything like this again, because once was truly enough.
Yeah, fair enough. Yeah, we did, I did an episode 6 months ago, whatever it was, about the morale here.
Yes.
And how it ebbs and flowed.
Yeah.
Yeah. So it was very stark, very noticeable, as people left, and then we're in our small group, and then people started coming back, and it got exciting because we got to see people, and then the mask mandate came, and we all had to put a mask on, and we all got quiet for a few days. Right. It was just up and down. And so that's the mental side of it as well, yes. and that's such a big deal.
Yeah.
So thanks for talking about that.
Absolutely.
So let's talk about the business side for a little bit. So where are you currently working? Where do you do your business, and where are you heading?
Sure. No, thank you. So Health Payment Systems was founded right here in southeastern Wisconsin, as we have our PPO network, which is very broad across the entire state, really from Madison to Milwaukee, and then up and down the coast. We are very strong from a physician's presence perspective and a hospital system perspective. We wrap our network in the state with a couple of the world-class, rental networks for where we don't have coverage, which is primarily up in northwestern Wisconsin. And then ultimately, as we sold our company, earlier this year, we took in a significant round of growth equity to help us really expand that concept of the Super EOB that we talked about through a product that we're going to be launching called the PayMedics Payment Network, which is effectively we're going to take our consumer experience and broaden it nationally. And we're going to be working with other folks that are of like mind in the insurance industry and in the healthcare industry itself that wish to bring a consumer differentiation point to help people understand their medical bills and help them have unique ways to pay over time, so that we can really help people do what they should be doing. They're getting a service, they should pay for it, but we also want to have that gentle helping hand to make sure that they understand why, and if they need time or help to pay, we can help them through that as well. And we're very excited about that. So we're looking forward to that expansion really starting next year in 2022 and running beyond, and hopefully being, as we come back in months to years, a national company.
That's a big deal. Nice. So that's a big get.
Yeah.
Congratulations on that. So I asked this about to every person I talk to that's in charge of a business or that's running a business. I just want to make sure I know what I'm listening to, because the reason that I call myself a networking nerd is because I'm always looking at ways of connecting people. So when I meet with business owners, I'm in my role as a human capital management consultant, I'm talking about their administrative processes and how they might be having some pain or want to investigate what's out there to see if there might be a way to improve that. While I'm doing that, while I'm talking to them and I'm listening to their answers, what am I listening for that says, maybe you should also be talking to Terry? What am I triggering on?
Sure. So for folks that really wish to understand and then solve for some of the complexities within healthcare, first and foremost, me and the team that I'm blessed to have are very educated on that and very willing to kind of get down into the dirt with people to really rip it open and talk about what's really there. Second, we in our services are alternatives to the national big insurance companies and some of the local healthcare systems that are offering a very narrow product as well. So the fact that we offer a network here in the state of Wisconsin, and we're going to be growing that over time, the fact that we have this really interesting and great consumer model to help the consumer understand and pay for their health care, and then ultimately the fact that we've been calling for employers to act on this as a fiduciary duty to their employees since the company was founded, to understand the cost, understand the pain that the employee is in, understand the plight of the human on the other side of healthcare. For folks that really get that and really want to effectively become really employee first and family first, we're perfect for that, and just helping them try and bring a unique and innovative solution to market and into their employee base. And I'd love to talk to every employer that wants to do that. Frankly, even if they don't choose us, just because there needs to be a larger community and groundswell movement for all of us to work together to continue to refine healthcare to the best that it can be here.
So when we're talking about what the benefit companies does and who we like to work with, we again are nationwide as well. We have clients across the country. We don't really have a specific size, don't have a specific industry that we spend our time in. We'll work with just about any type of business on those things that we do. Talk about that. Does HPS really have a niche or a specific ideal client size, industry, anything like that?
Yeah, I mean, right now, just because our PPO network here is in the state of Wisconsin, it's mainly Wisconsin-based organizations. And then those that really wish to either evaluate or are self or level funded. That really is our niche in terms of where we are playing very strong, where we have really good market value. As we are privileged to grow, our network product, and then also privileged to grow our consumer financial product into other states and venues, we're excited about some companies that we may have them here in the state of Wisconsin, but they use a national carrier for a location in Kansas or something like that. We're really excited that we're going to be able to bring the consumer side of that solution to them wherever their employees are as we really get into next year and beyond, which will be a great thing for everybody.
Nice.
Yeah.
So also, as I looked at your website and again got familiar with everything there, and because I know you as well on a personal side, you are and continue to be someone who gives back to the community. So take a minute and talk about what you folks do at the company level and maybe some of your own personal pet projects. I know you recently took a leadership role in the Leukemia and Lymphoma Society fundraising effort that goes on a regular basis. So maybe talk about some of those things.
Sure. We had a really unique opportunity with the company in 2018 where we asked our team to effectively redefine our core values. And it was a really watershed moment for the company because we had been running under one premise of why we existed as a company and why we were here as team members and why we were here as a family. And the company really came back to 4 really simple core value statements. And the top of that was take care of your fellow human. It's on our website. It's on a bunch of things that we have. And it's not just words on a wall. It's what really happens in the halls, or these days virtually what happens in the halls, in terms of what's going on. But as a part of that, we really do believe in community outreach and giving back. And whether it be projects that we sponsor down in the city to help in education and in the STEM programs, whether it be things like the Hunger Task Force or Habitat for Humanity. And then a personal and really kind of heartfelt project for our firm is really LOS that you spoke of, Leukemia and Lymphoma Society. And that's really personal because our founder ended up unfortunately passing of leukemia. A couple of members of our families within the companies have had it as well and are survivors of it and now thriving in their life. But we really believe that that's a really personal and dear cause for us and for me personally, just as a part of that as well, in terms of just really feeling that draw and that need to give back. And then ultimately, we are a very, very resilient, family at HPS in terms of what's going on. And we are very involved in one another's lives, which is an awesome environment to have and to work in. And we're a great melting pot of different faiths, different venues of where people send their kids to school and things from that perspective. And that just matched 100% in my own personal, wheelhouse as well. In terms of giving back, in terms of both the community of education so that we can raise stronger leaders through the future. And then also, my own faith life that you're aware of and others are aware of in the community as well. And it's really great to be able to be a manager of a company and be a leader of a company that has those same kind of core attributes and ethics in them as well.
I appreciate that because we have that here too.
Yeah.
So I get it.
Yeah.
All right. So we've come to the point where now it's commercial time. You need to do the commercial for HPS that says, okay, here's who we are, what we do, why we do it better than anybody else. So give us a commercial.
So as I saw as a customer of Health Payment Systems and now, ultimately coming on as an employee and then as a leader of the organization and as someone that helped convince others to invest in the company, we are a core group of individuals that first and foremost want to take care of our fellow human. And the avenue that we're doing that is through bringing a really unique set of healthcare products or products focused in healthcare into the marketplace, both from that network that we talked about to be able to get people to the right medical professionals to help them with what's going on within their lives. And then with this really great consumer engagement model to really help the employees and their families and just understand the backside of healthcare that's so underserved in terms of what's going on from a billing perspective. And to be there for the human when they have a question about what took place in their medical life. And again, if we can't solve it for them, even though we try and make it so abundantly clear and simple, we jump into kind of that advocate mode and we get back to people and don't just follow up, we follow through. And I think that's what really gives us that leg up in the marketplace and allows us to have a really good preferential place with some of our healthcare community and most certainly with a very large number of our employers in southeastern Wisconsin and beyond.
All right. So also let's add to that. What's the best way to get a hold of you folks? I mean, website, phone, whatever you want to share there.
Sure. So ultimately, hps.md. So the .md is a little bit non-conventional, which matches us as a company, which is great. And it has all of our contact information on there as well. And then ultimately, you can get a hold of me, Terry Rowinski, and you can find me on LinkedIn. And I'm just simply terry@hps.md. And again, I'd love to speak with whomever really wants to engage in conversations about the things that we've hit today and more.
So speaking of that, did we cover it all? Is there anything else we didn't talk about that you wanted to hit?
Golly, there's so much going on in the world these days, Roger, and just coming over, listening to England and Europe opening and their Liberation Day or whatever they're celebrating, and then ultimately still the plight that the people are under because COVID is not relenting in certain cases. My own personal call is for people to take care of your physical health, take care of your mental health, and those will lead to good outcomes for hopefully having a very healthy and productive life. And I'll just use that as my 2-second commercial if I can. So
excellent. All right. So this isn't all business. I mean, I always like to throw in one thing and see if I can catch somebody with an interesting story. So tell me about something crazy, funny, a failure, doesn't matter, something in your past that makes you even a little more human to us, because I've certainly got those. Well, give me something there.
Oh, golly. I think earlier in my career, when I first came out of school, and I'm a product of the University of Wisconsin system here, which is a great institution, and I worked for a small software development company that used to be up the road here called McHugh Software that's sold and rebranded multiple times. I was out in Massachusetts at a manufacturing plant for a company in the day that was known as Digital Equipment Corporation. A little bit younger version of myself, a little bit more hair and a little bit more color in my hair at the time, and it was one of those careers that I just loved it so much I would literally work myself until I was blue in the face. At times I actually did, and one day I did work myself till I was blue in the face because we were supposed to go live with this new system for what they were doing to manufacture PCs back in the day. And I had literally been at this location by myself, because my folks were coming in to get ready to go live for the rest of the company. And I had actually forgotten to eat and sleep for about a day and a half. And those were in the days where I was much younger, except for when I got up and all of a sudden I ended up being on the floor. And the next thing I woke up, I was in a hospital room with people wondering what was going on with me. So, it was just one of those things where you become so impassioned, so ingrained of just trying to do a good job and do the stuff that you need to do that you forget about your own self. And that really was that kind of thump moment where I learned, fortunately, really early in life, that there does have to be a balance of everything that you're doing, and you do need to take care of oneself. And ultimately, I didn't need a plaque to be put in a building to say, it went so well, he worked himself almost to death. So
wow,
yeah.
I never face planted in anything I've done in the past.
No, you don't want to, actually. So. Those are the days you're thankful you're wearing underwear, because you never know what you're going to wake up and see.
There you go.
We'll just let the audience.
So we talked about a bunch of stuff, but you have some great stuff coming down the pipe for you folks in the next year or so. Right. So I want to reserve some time for you to come back. Please do that.
Please, that'd be awesome.
When we have the invite to come back.
Yeah.
Is there anything else you want to share before we call it a session today?
No, just thanks. I mean, Wisconsin is a wonderful place to do business. We're incredibly blessed to be a part of this community and got a lot of exciting things going on in our backyard right now. I hope by the time people hear this, they're celebrating a world championship in basketball. That would be really awesome.
It would be.
And if it doesn't happen, it's not my fault. So, but no, thanks for the time, Roger.
Terry, good to see you. Thanks. And thanks for listening. Join us again next week for another episode of Inside Connect and Simplify. Until then, be well.
We appreciate you giving us a listen and learning about the benefit companies. Find our podcast and everything you want to know about our trademark human capital management platform, Connect and Simplify, at connectandsimplify.com. You can also find our podcast at Podbean, Pandora, Google Podcasts, Listen Notes, Amazon Music, Spotify, iHeartRadio, Apple Podcasts, and Alexa. Thanks for listening.